this is his back. This is T13, so the 13th thoracic vertebra. This is the spinal cord, and we can see there's this mass here. And in cross-section over here, and it's more off to the left side, it's this white thing here. You can zoom it in. It's relatively sizable. Hopefully it's a meningioma, but we don't know until we try and take it out. So that's what we're going to talk about with the owners today, of what our different options are, whether it's continuing with medications, considering surgery, or considering something like radiation. Hello, how are you?
How are you?
Hi, how are you?
He's been really peppy in his walk.
All right, let's go back to Dad. Cut.
Cut.
I like this. It's a springy.
Yeah.
It's definitely improved. I mean, it's certainly not 100%. You know, there isn't a right or wrong with this. You know, again, the pros of, I guess, of doing, I won't say as much as we can, but doing, you know, surgery, radiation, etc. He's relatively young. You know, it's not like he's a tiny dog. These surgeries tend to be easier on bigger dogs just because there's more space. And you know, he's responded so well to prednisone. And then just having been in this situation before, you know, sometimes you know, owners come back to me 3-4 months later and say, okay, you know, he's getting worse now, we want to do something. And you know, there's no better day than today to be, you know, the tumor's never going to be smaller than it is right now. So do you have any other questions?
I don't think so.
No, I think we've covered everything. Thank you very much.
Got it. See you Wednesday, okay?
All right, thanks, Doc.
Right. Thank you.
You got it. See you, mister.
Okay.
I will remember 9/6. I will put it in my calendar so I don't forget it.
Okay. Thank you. So every time I turn my head, it's like.
So now I have enough scrubs that I don't need to do laundry for like 2 weeks.
Oh, that's nice.
Like over the years, I've accumulated enough. Like I have an entire drawer that I'm fairly certain only the top 4 get used.
Yeah.
And there's like 20 below
Yeah,
it.
exactly. And you see that the colors change
It fades,
because
yeah.
you wash the same 3 over
Yep.
and over and over.
Well, there's also like when we get them, they order different.
Yeah.
Yeah,
Mhm.
I have some
Right.
that I don't like.
And then they
they're at
don't
the
match.
bottom.
Also,
They're
the
when I
pants and
haven't
the shirt
done the
doesn't match.
laundry.
Exactly.
That drives Marianne nuts. If I walk out of the house and they don't match, it's like back upstairs.
Had some weakness. What's happening?
I like variety, I think.
Thanks. Had some pelvic limb weakness. He was scuffing a little bit. Since July 13th, it's gotten worse. He's now crossing his pelvic limbs. He's swaying out quite a bit. Dad doesn't feel like he's ever been painful at home and is unsure what he can do because he's not working, and Dad is like lifting him into the car, lifting him out of the car, all of that stuff. Dad being the handler and also Dad. They did some x-rays, they did the CT scan, found an LS disc on the CT. Neither here nor there. On his exam, cranial nerves and forelimbs look normal. He has proprioceptive deficits in the pelvic limbs. His reflexes seem strong in the pelvic limbs. Dad doesn't report any fecal or urinary incontinence. He doesn't seem overly painful. His tail is swelling. Doesn't seem overly painful anywhere, although he started getting to be a police dog and growling at me kind of halfway through the exam, so a little bit tough to say. But overall, I would localize him to T3 L3. Talk to Dad about, is it a disc, is it a tumor, is it an infection, versus all the other less likely things. Talk to him about working up. He seems interested, but the dog ate breakfast this morning.
I talked to Dr. Green last week, and Dr. DeVita just kind of told me we originally noticed some weakness in the rear limbs prior to the chase. He was weak even before then, but it started getting worse after that, or suddenly got worse after that. And since then, we've just started having more weakness in our rear limbs. Never really seemed painful, but it came on relatively suddenly. I mean, 6
Yeah.
months ago, he was completely normal.
He's like, oh, I've done this before.
So I guess, do you have any videos of him walking even just like 3, 4, or 5 months ago, anything like that, or 2 months ago?
I was slippery, but I'm trying to see. You know, if we move so much. You see his back legs are moving.
So the way he walks is more suggestive of a spinal cord problem affecting his back, somewhere between his front legs and his back legs. So the things that we worry about are things like slipped discs, things like tumors, things like infection, things like meningitis, things like strokes, things like malformations, like fluid pockets, things like degenerative myelopathy. Those are the things that we kind of see in adult to 8-year-old shepherds. Things like infection, things like slipped discs, things like meningitis are typically painful, which he doesn't seem to be. Things like strokes can be non-painful, but usually don't get worse over time. Things like degenerative myelopathy can cause rear limb weakness and incoordination that is non-painful, but usually that comes on really, really slowly. And that's the main reason that I wanted to see videos of him, just to see when did the weakness really start.
Literally July.
And that's important to know, because we don't want it to be degenerative myelopathy, and there's not a lot that we can do about that. That just slowly gets worse. But he doesn't fit into one exact box, so to speak. Most dogs with slipped discs, while they can come on suddenly and get worse over a month or so, usually they're painful. Obviously every dog is different. Our expectation is most working dogs have a higher pain tolerance than others. He obviously has a high drive, but most dogs, that if it hurts, someone will notice that. So, and I don't get the sense that he's painful. So, still could be a slip disc. That's still kind of number one on our worry list. Things like tumors need to be on our worry list, while they don't typically come on suddenly, just with his age, with the progression that needs to be on our worry list. So the rationale for today was, one, for us to see, does it look like a neurological problem? It absolutely does. 2, to say where in his neurological system is the problem, and it seems to be more of his mid-back as opposed to his low back, which is where the CAT scan suggested that there might be a problem. And then to discuss doing an MRI, because the CAT scans are good for looking at things like bones, but they're really not good for looking for any of those things that we mentioned. They're not good for looking for slipped discs, they're not good for looking for meningitis, and they're not good for looking for degenerative myelopathy. They're not good for looking for...
Isn't there a test for that?
So for degenerative myelopathy, there's a blood test that we can send off, yes. That takes about 2 weeks to get the results back. And just because, if you told me he had been wobbly for 6 months, I'd say, yeah, before we do anything else, we should submit that test. Because you feel pretty strongly that, in June he was normal, in July he started being abnormal, and it came on relatively suddenly. It's not wrong to submit that test, but by itself it's not going to give us the complete picture. So the idea was for an MRI. That's the best way for us to see his spinal cord and tell you, does it look like a tumor, does it look like a slipped disc, et cetera, et cetera. By knowing what the cause is, I can better tell you, can we fix it? How can we fix it? What's the likelihood of it coming back? What's the likelihood of him, returning to full work? So ideally, since MRIs require anesthesia, ideally he would have been fasted. I apologize for our part in kind of a miscommunication. But if we're gonna do an MRI, ideally he'd be fasted so that, you know,
No complications.
no complications. Exactly. All right, big man.
Say bye.
Is that fun? You got to hang out, huh?
Get your toy. Get the toy.
Alrighty, let us know if you've got any questions, or if anybody has any questions, I'm happy to get on the phone, okay?
Thank you. All right.
We'll walk you guys up.
We both walk
We can
up.
walk up together.
Here. Oh, you always go that way. Here. Get the toy.
He's playing now with my son.
Okay.
I never met, yeah.
Yeah.
So he's doing great, and I tell you what, we're going a lot outside the country for months or
Okay.
something like that. And this time I'm gonna take him. We're gonna be in Tel Aviv and in Europe.
Okay.
So I'm gonna take him to Tel Aviv with me.
So I guess the $1 million question is, do we continue the phenobarbital or not? If we do, we should do some blood work today, just like we did 2 years ago. CBC, chemistry, phenobarbital level. If we're going to make the argument of stopping it, which is not wrong, I feel less important that we do a phenobarbital level today, because if we're going to just take him off of it.
You're okay, boo-boo. I'm just gonna pull your blood.
Hi, how are you? Nice to meet you, Jordan. Don't meet Jordan. He's definitely been resting, but he will get up and just go to his bowl, you know, any of that stuff.
When was the last time you like screamed out?
I want to say it was like probably he had the fentanyl patch on, and it was like a week into this whole process. It was like last weekend. A friend of mine came over and kind of hit the top of his head with her elbow, like when she went to move back on the couch, and he let out like a really interesting type of squeal, and then he became super tight and started trembling again, and this became swollen again. It was extremely swollen the first day that we realized all this was happening, but it's gotten better. He's had a lot of action actually today, like jumping when he sees another dog,
Right.
which is the first time that we've seen that happen in a while.
The most common cause of neck pain in a 2-year-old French Bulldog is a slipped disc. That's what Fitzgerald had, that's what most 2-year-old Frenchies that we see have.
Great.
But Frenchies also get a bunch of other stuff that can cause the exact same symptoms. They can get meningitis at 2 years of age that can cause the exact same symptoms. Neck pain, kind of sporadic. It does not necessarily mean that they're going to have a fever. It does not necessarily mean that they're going to act sick. Does not necessarily mean that their blood work will be abnormal. This could totally be meningitis causing the exact same symptoms.
Okay. When it is meningitis, what's the route for that?
So that's a medication treatment.
Okay.
So it does not require surgery.
Okay.
The next thing that we think of would be something like an infection, what we call discospondylitis. That's an infection of the intervertebral disc and of the bones on either side of the disc, and again can cause the exact same symptoms of intermittent pain.
Okay.
Usually it will get worse with time, but you know, good days, bad days, good days, bad days.
Yeah.
Um,
It's kind of like tricking me though, because like when he's better, I'm like, okay, it's
Yeah.
working, and then he does one little thing. I mean, it's something not even crazy at all, and then he's back to, you know, like almost crumbling.
Yeah.
It's weird, and he won't lift his head for a treat.
Yep.
He's like a big treat guy, so that's
too.
a red flag in me too.
So-
He won't even. Yeah, you can tell when they at Knowles were trying to lift his head. I mean,
Yeah.
he's like basically fighting back.
Yeah, and I'm not gonna try and squeeze on his neck real
Yeah.
hard or manipulate him just to prove it. What you're describing is neck pain. I don't need to make him, hurt.
The only thing I told her that would.
So, the likelihood is that this is a slipped disc. There are 2 ways that we can approach it. Approach number 1 is rest and medications, which we've been doing medications. Most of the time they'll kind of rest themselves at first, but as they start feeling better, they start doing more, or friends come over, they see other dogs, etc. So they really can't get as much rest as they should. So rule of thumb with that is most dogs, if they're going to get better, they'll do so in about a week, 2 at the most. So we haven't really been resting him, so we'll call today day 0, so to speak, with regards to us assessing is rest and medications going to work. And So most dogs, if they're going to get better, they will in 2 weeks or so. We'll typically want to see him back in a week to 10 days just to make sure he's getting better.
Alrighty.
All right, do you have any other questions for me?
No.
Alrighty.
You guys are good.
We'll keep everything together for you. Give us maybe 8-10 minutes to get all the medications together.
Perfect.
Okay?
Thank
All right,
you. I
call
really
us if you
appreciate
need
it.
anything.
Nice meeting you.
All right.
Okay. So, and then,
If you mess it up once, like it's impossible to.
Another course of Gabatran Valium.
Yes.
Okay, cool.
hi.
Fitzgerald
Hi.
is ready in room 2.
Okay.
Okay.
Okay. Hello, how are you?
Good, how
to
are
see
you?
Oh, Fitzgerald's doing fantastic. I mean, he's, for all purposes, back to normal.
Yeah, he looks.
Surgery went great. Do you want to see the MRI at all? or-
The other doctor
They
showed
showed
it to
you.
me, and I have some pictures of it.
Okay.
Yeah.
Do you have any questions for me then?
Not really. I mean,
Okay.
he's. I just wanted the likelihood of him like getting this again. Is it common?
It's
or?
about 10% chance of having another disc problem at some point in his life.
Okay.
So.
Yeah. You wearing new clothes?
Yes.
You wearing new clothes, Toti? That looks awesome.
It's like a little muscle shirt on him. I'm Sunny. I'm
Hi, nice to
one of the
meet you.
rehab therapists. How are you?
Good, how are you?
So I'm gonna go over a couple little exercises with you. As you can see, he's doing really, really well.
I love you, big girl.
Eyeball.
Eyeball. Okay, good night. I'll see you in the morning. What did you say?
Are you going back to work?
Yeah, I gotta go take care of a puppy.
Daddy, why are you going, the first time you, take care of a puppy?
What? Good night, buddy. I'll see you in the morning. I'll go over. Bye-bye. On our way in to go see a non-ambulatory French Bulldog. He's paralyzed acutely today. This is something that's an emergency, so we are available after hours. So I am going into the office now. Fixed Frenchie. A big disc at L4-5 that went up to L3-4. Wow, strength of the bear. There we are. There we go. Should do great.